Onychomycosis or fungal nail infection is a common and contagious condition. Clinical diagnosis requires confirmation because approximately 50% of dystrophic nails are due to fungal infection. Dermatophyte or non-dermatophyte fungi may be involved. However, dermatophyte infection is implicated in over 90% of cases of toenail onychomycosis. Trichophyton rubrum is the most commonly identified fungus, accounting for about 70% of all toenail fungal nail infections. Microbiological confirmation of the diagnosis is essential for correct treatment and requires pathology testing of a suitable nail sample. Many published data indicate that false negative rates of 30% or more are typical. Of the 50% of dystrophic nails which are fungal in origin, 1/3 will be diagnosed as not having fungal nail infection present based on the microbiological results from the samples provided to the laboratory. Collecting a good sample is the vital first step in confirming the correct diagnosis in a patient with dystrophic nails. A good sample that allows accurate microbiological confirmation of the diagnosis is essential for patients with onychomycosis to receive appropriate treatment for their condition. Collection of a good sample depends on the skills and knowledge of the person performing the collection. This resource has been specifically developed to illustrate good nail sampling technique in order to improve diagnostic accuracy in patients with suspected onychomycosis. The importance of taking a good nail sample cannot be underestimated. The rates at which positive isolates are found can be improved by improving the quality of the specimens collected, the key first step in the microbiological confirmation of onychomycosis. There are 3 steps in the diagnosis of fungal nail infections. The first is clinical diagnosis, performed visually by the doctor, then referral and collection of an appropriate specimen, and forwarding of the specimen to a laboratory for confirmation of fungal etiology. We will now look at the process of taking a sample in detail. Prior to the patient arriving, the necessary equipment is set out, including alcohol swabs, clippers, a suitable marker, scalpel blades, and sample containers. The examination bed should be covered in a disposable paper sheet. Disposable gloves and safety glasses, if eyeglasses are not worn, must be used. It is useful to get some information from the patient regarding the history and progression of the nail involvement and the treatments they have tried. Examine the nails to determine the extent of involvement and to choose the best sampling site. Again, it may be useful to use alcohol swabs to wipe the affected nail or nails to help visualize the affected area more clearly. Once you have selected a nail to sample, carefully position the sample container so that as pieces of nail are clipped and the underlying debris is scraped away, these fall into the container. In each case, it is essential to clip away the nail plate and then scrape debris from the nail bed below to provide the best specimen. It is important to take a sample from the most active site of fungal growth. This is the leading edge of the infection at the site of demarcation between the affected and healthy areas of the nail. Toenails are affected in about 80% of all cases of onychomycosis. Let's take a few moments to review the different sites of the nail that might be affected. Distal subungual onychomycosis, or DSO. In this case, it is necessary to collect the specimen from the distal area. Lateral subungual onychomycosis, or LSO. Here, collect specimens from the lateral area. The majority of cases of onychomycosis involve both the distal and lateral areas, in which case we have distal and lateral subungual onychomycosis, or DLSO. The condition may involve the entire nail to varying degrees, resulting in total dystrophic onychomycosis, or TDO. In this case, it is appropriate to collect specimens from suitable areas anywhere on the nail. Another type of fungal nail involvement might be seen in which pockets of fungus appear as white patches on the superficial nail plate. This is superficial white onychomycosis, or SWO. With time, the individual pockets may increase in size and eventually involve the entire nail, resulting in total dystrophic onychomycosis, or TDO. In this setting, it is necessary to collect the specimen from an involved patch. Sampling involves scraping down through the affected surface toward the nail bed in order to obtain a suitable sample. Once you've made sure the most suitable site is sampled, the next most important thing is to make sure that sufficient suitable material is removed for viable culture and microbiological evaluation. Insufficient sample material is one of the most common pitfalls seen in daily pathology practice. These samples all provide sufficient material for evaluation, while this other sample provided is barely visible and is unsuitable for further evaluation. Once the sample or samples have been collected, ensure the containers are well sealed. In this case, the Petri dish is being sealed around its entire circumference with tape, and appropriately marked, for example, using an indelible felt tip marker before being placed in a specimen bag. Provided a specimen has been taken from a suitable site and contains both affected nail and debris from the nail bed in sufficient quantity, laboratory procedures will be able to confirm whether or not fungi are present in the sample. Let's take a moment to look at the clippers used for sampling. The clippers should fit in the hand comfortably and be spring-loaded. Curved jaws are more practical than straight jaws as they conform more closely to the shape of the nail and the nail bed, allowing better access. The clippers can also be held in the manner shown and used to scrape debris from the nail bed or to take scrapings from superficial lesions. After taking a sample, the clippers should be wiped of any debris using an alcohol swab and placed in alcohol. Other disinfection procedures may etch the surface of the clippers, causing surface defects that may then harbour fungi or other infective agents. In summary, what are the key things to remember from this resource? Studies indicate that approximately 50% of dystrophic nails are due to fungal infection, and up to 3 out of 10 samples collected provide a false negative result. Better sampling techniques provide better results. When taking a sample, make sure samples are taken from a suitable site. The line formed by the advancing infection between dystrophic and healthy nail is the site of active fungal development. This may be distal, lateral, combined distal-lateral, or proximal onychomycosis. It may involve the complete nail or individual superficial patches. It is essential to clip away the nail plate and then scrape debris from the nail bed below to provide the best specimen. The third key point is to make sure the sample taken contains sufficient material for evaluation. We hope you have found this resource useful. Development of this resource was made possible by an unrestricted educational grant from Novartis Australia, makers of Lamisil. Visit fungusfreenails.com. This is an information site for those affected by fungal nail infection. A link is provided on the main menu page to take you directly to this site if you are online while viewing this resource.